Thank you for watching. Our subject today will be hand hygiene. Our learning objectives for today will be understanding why rates of non-compliance with hand hygiene are so high. Identify the best way to prevent healthcare-associated infections, and know when to use alcohol-based hand rub and soap and water to cleanse your hands. What is good hand hygiene? Well, one is recognizing hand hygiene opportunities. When should you be cleaning your hands? Always prior to entering a room with the patient or exiting a room with the patient. Choosing the correct hand hygiene method. So when should you wash with soap and water instead of using alcohol-based hand rub? And using proper techniques to decontaminate your hands. How to ensure that your hands are actually clean. And then making hand hygiene a patient safety priority. How do you engage your patients in hand hygiene safety? Why aren't we washing our hands? Studies continue to find that hand hygiene compliance rates of only 50% at best. Some of the reasons are because gloves were being mistakenly used instead. Staff members' hands were full of supplies. No sinks or hand rub dispensers were close by. Frequent entry and exit to and from a patient's room. Confusion exists regarding when hands should be cleansed or washed. Confusion existed on how they should be cleansed and washed. And when staff see senior staff members skipping hand washing, they are more than likely to skip it themselves. What do our hand hygiene rates look like? HealthPoint is currently using a hand hygiene observation tool to assess hand hygiene practices. Initial observations suggested our current compliance rate was at 15%. Let's improve this for our patient safety and our safety as well. Pop quiz. Which of the following could contaminate your hands? Removing gloves, which is not a substitute for hand hygiene. Taking a patient's pulse, contact with blood or body fluids, operating medical equipment near a patient, touching a patient's clothing, or touching a surface in a patient care area. The correct answer is all of them. All of them could contaminate your hands. Generally speaking, when to use alcohol-based hand rub and when to use soap and water. Alcohol-based hand rub is good to be used when hands are not visibly soiled, or before and after most patient contact. Soap and water, well, hand washing is always an acceptable alternative. When the hands are visibly soiled or contaminated with body fluids or blood, it's time to use soap and water. Let's review some specific hand hygiene situations. You have body fluids on your hands. Do you reach for the alcohol-based hand rub or the soap and water? Right, the soap and water. If your hands are visibly dirty or contaminated with materials or visible soiled with blood or body fluids, you should be washing them with soap and water. What about before you have a direct contact with the patient or after contact with the patient with intact skin? Taking a patient's pulse, for example. Right, alcohol-based hand rub. As long as your hands are not visibly soiled, alcohol hand-based rub works great. Say you didn't touch the patient. You just walked in to check in on a monitor setting. Do you have to sanitize your hands? Correct answer is yes, you do. When it's time for lunch or another meal, how do you wash your hands? That's right, soap and water. Always make sure you wash your hands with soap and water after you use the restroom as well. Why alcohol-based hand rub? Remember, soap and water is always an option for hand hygiene, but the use of alcohol-based hand rub has its advantages. It takes less time, it's effective, and dispensers can be installed in multiple convenient locations. The technique for alcohol-based hand rub is applying the product to your hand Follow the manufacturer's recommendation regarding the amount you should use. So for example, GBG Aloe Gel states to apply a liberal amount to unsoiled hands. Rub together, covering all surfaces of your hands and your fingers until hands are dry. Soap and water technique is wet your hands with water. Apply the amount of soap recommended by the manufacturer. Rub your hands for about 15 seconds. You can sing the happy birthday song twice or the ABCs. Rinse your hands with water. Dry thoroughly with a disposable towel and use the disposable towel to turn off the water faucet. Hand hygiene support. Gloves. Wear gloves when you think that contact with any of the following will occur: blood, potential infectious material, mucous membranes, or non-intact skin. Remove gloves after caring for a patient. Do not wear the same pair of gloves for the care of more than one patient, even if you did not touch the patient. Do not wash your gloves in between uses, and change your gloves during a patient care if you're moving from one contaminated body site to a clean body site. HealthPoint's policy on fingernails is for any healthcare worker who provides direct patient care, handles products used for direct patient care, for example, a pharmacy, or cares for the environment, such as a housekeeper. HealthPoint's infectious control plan prohibits wearing artificial nails that exceed 1/4 inch over the fingertip, including any product applied to the nails other than its standard nail polish, nail jewelry, or long natural nails greater than 1/4 inch over the fingertip. Are your nails in compliance? Points to remember. Bacteria can survive for days on hard surfaces, such as equipment, tables, or computer keyboards. Remind coworkers to clean their hands too. Use your standards of behavior to remind fellow staff members to clean their hands. Involve patients. Teach them about the importance of cleaning their hands and ask you if you cleaned yours. The expectations and the goals for our future is to speak up. Do you see a potential location for alcohol-based rub hand dispenser, or do you notice a problem with our hand washing station? Prevent the HIAs. Look for opportunities to improve hand hygiene. Encourage patients to practice good hand hygiene and increase awareness of the importance of proper hand hygiene. You can fight the infection and even save patients' lives by just washing your hands. Thank you for watching. Have a great day.